In 2012 and 2013, Mylan spent about $4 million on lobbying to ensure that EpiPens had to be made accessible in schools. It would be required as part of the Emergency Epinephrine Act. Mylan also happens to be the top corporate sponsor of a group called Food Allergy Research Education. So we thought, let's bring them in. We are joined now in a Fox Business exclusive by their CEO, Dr. James Baker. Dr. Baker, first of all, what is your group's reaction to this price spike that has happened seemingly overnight, but it's been a couple of years, with the absence of any bigger developments in how the drug actually worked? They haven't put a penny into this.
Yes, well, Liz, our major concern is that our members, who all, literally everyone, require this life-saving drug, have access to it regardless of price. And I think what we've seen over the past year or so is that as the number of competitors in the market has decreased, as Mylan's percentage has increased, the price has gone up. And not only just the price, but the price people are seeing has gone up because under the ACA, insurers are causing people to pay more of the price for these drugs before they cover with their insurance.
You mean higher deductibles? So one of the sort of unintended consequences I'm hearing you say of Obamacare is that people have to shoulder more of the cost of an EpiPen, correct?
They have more out of pocket, and they have a higher level that they have to pay for before the insurance kicks in. Yes.
Okay, that is a blame put on Obamacare that is just so annoying, but let me focus on Mylan for a moment. Why have they continued to drive this price up when they haven't really, they put a lot of money into marketing, a lot of money into lobbying, doctor, but they haven't really further developed the drug, which seems to be working perfectly fine. And by the way, the drug, epinephrine, only costs $1 per shot. So why is my nephew, who's suffering from a fatal milk allergy, paying, or his insurance company, somebody's paying, $700 for 2 of these?
Yes, I mean, I can't tell you the rationale behind Mylan's pricing.
Have you talked to them? They're on your website as your #1 corporate partner.
Yeah, well, we have to have them as a corporate partner. They're the only company that makes a life-saving medicine that all of our members need. And they're less than 3 or 5% of our overall revenue, and it just goes for activities. The important thing is that we're trying to encourage good behavior. We're asking them to set up access programs so no child is without epinephrine because they can't afford it. We're also working to get others into the marketplace to provide competition.
Okay.
This spike occurred when one of the other competitors left the market. So yeah, we're trying to do things that are right for our members.
Well, I can tell you right now that perhaps you guys should be demanding some type of emergency board meeting at Mylan. Would you consider asking them to do that? We can't get through to Mylan. Their PR person will not return our calls. We have requested multiple times for them to at least speak with us to make sure we have it. But, you know, we put 3 of the board members on here, the Mylan chairman, the Mylan CEO, Heather Bresch, Robert Curry's the chairman, Rodney Piott, who's the vice chair, and he's supposed to be the independent director. There are all kinds of issues with him. Do you think Mylan should have an emergency board meeting to discuss dropping the price?
We have been talking with them for over a year about developing an access program.
Okay, so they're not listening then because they haven't done it. Why is this taking more than a year?
I don't know, but we are ready, willing, and waiting to work to make sure no one is without this drug.
You know, people on Medicare, I should mention, they still do have to shoulder a minimum of $100 per this. It's not like anybody's getting this for free. Mylan hands out a bunch of coupons. I'm hearing from hundreds of frustrated people on this. We hope you can get some action, and if you do, please come back.
Well, thank you very much, and thank you for highlighting this issue, which is very important to our members.
We understand. 15 million people in America suffer from this, and you were saying, what, two out of every kindergartner, 2 children out of every kindergarten class?
2 children in every kindergartner class now have a clinically significant food allergy.
I hope Mylan addresses this issue soon. James Baker, thank you very much. We appreciate it, doctor.
Thank you.